Anyway, this next speaker, are we there? We have Monisha Bhanote. She was a guest last night. I think guest last night. I guess she was a guest last night, but she was also a guest speaker last year. And we're proud to have her back. And thank you very much. If we can welcome Dr. Bhanote up on stage here in her beautiful green. I love it. Thank you. Here's a clicker. Welcome again.
I think I'm taller than I actually am. Let me move this down a little bit. As long as you guys can hear me. Well, hello, everyone. Nice to see you again this year. I'm excited to be talking to you. So thank you, Annie Appleseed, for having me back again. I recommend if you're in the back, move up. Nobody up here bites. We love to hang out, and I'm going to tell you why. We're going to get closer in a minute. So today's talk is all about the gut microbiome and some of the modifiable lab factors that you can take control of absolutely today. And if your doctor has not tested these yet, you definitely want to get these tested. So the first thing is, I need a volunteer. Who can be my volunteer? First one to raise their hand. Please come up here. Let's just stand here. Now, all of you guys, there was less than 10 people at yoga this morning. Why do I know that? Because I walked through and saw, right? Which means all of you stand up. Every single one of you who missed yoga, stand up. If you didn't, and you went, you can sit, but still I recommend you stand up. Mic on. Can you hear me better now? All right, perfect. So you're standing up. Make sure you are standing next to a person. Make some eye contact with somebody. Make a new friend. Find a friend. Call home. Find a friend. Okay, this young lady over here in the green needs a friend. You can't do this alone. Everybody should be with 2 people. Julia, who's your friend over there? John? Okay, make sure you guys got all friends. Anybody doesn't have a friend, please raise your hand. This lady over here in black, she needs a friend. Can somebody go make friends with her? Anybody else need a friend, or are we all good? Okay, this gentleman over here in blue needs a friend. Oh, looks like you're going to get special Julia. You got like a really good friend. There you go. All right, are we all good with our friends? Now turn towards your friend. Come a little closer. I don't bite, but my microphone might not. All right. And when you're ready, put your right hand on your own belly. Make sure you're facing your friend. Put your right hand on your belly. Take a deep breath in. And exhale it out. Now take your left hand and put it on the person's hand. If you don't want to touch them, you can just put it in front. And now I want you to take another deep breath in. And when you exhale, feel the warmth that's spreading from your hand to this individual's hand. If you're comfortable, you can close your eyes and continue to breathe. And imagine that this energy that you are creating is transforming the molecules inside your body and creating healthy, happy molecules that are going and healing each and every cell in your body. Continue to breathe. As you inhale and you exhale, feel the warmth. Let's breathe one more time through our nose. Exhale with a loud sigh through our mouth. When you're ready, you can open your eyes. Look at your partner in their face. Thank them for joining you. Give them a hug. That was an easy thing, and guess what? Here you go. Here's a book. You're very welcome. Thank you for joining. That is me. That is me. That is my book. So, does anybody know why we did that? What was the point of doing that? Do you know what the point of doing that was? But why were we breathing? We were breathing because guess what? You guys just released oxytocin. Okay? Because you created a connection with somebody. You also got into the parasympathetic state. Guess what? The body heals when it is relaxed. The body does not heal from a place of fear, from a place of stress. The body cannot heal. Okay? So anytime you are feeling overwhelmed, take a moment to take a breath, whether that's with yourself or with somebody else, because that is the way that your body is going to heal. And, you know, yesterday I was like kind of listening to some conversations and a lot of people felt overwhelmed. Like this conference can definitely be overwhelming when you come to it. There's a lot of information out there. You're like, well, does that apply to me? Does it not apply to me? And I always want you to think, all right, you're getting the information, but that does not mean you need to act on it. Okay? Just take the information in and understand it first before you react, right? Because when we quickly react, we're creating stress in our body, and that stress can't allow our body to heal. So that's why we started this morning with that very, very simple practice, because now I want you to be able to take in the information that I'm going to give you from a place of calm and a relaxed state, not from a place of, oh no, what is she going to tell me? What do I have in store? Because that would not be my way of helping you heal. Okay? So with that, I'm going to give you some questions, and I would love to see the individuals who know this to raise their hand. So did you know that your genetics account for less than 10% of most cancers? Meaning lifestyle and environment play a role. So a majority of you guys know that. So that's good. That's good progress, right? Because if your doctor doesn't know that, you can tell your doctor. All right? So that is very important. How about this one? Did you know that there's a key immune marker in your gut that serves as the line of defense, and it's measurable? Anybody? That's the one you guys don't know. And I guarantee probably most of you haven't had it tested. But you will after this. Sorry. Got to control two hands. So, the key immune marker in your gut that serves as your body's first line of defense. Now the next one. Did you know that there's certain enzymes that your gut bacteria produce that could be silently increasing your risk of cancer? You know that one? Okay, we have one person, but most of you guys don't. So you're going to definitely learn something in today's talk. And then, did you know that your gut microbiome produces compounds that hold the secret to preventing inflammation and disease? It's very important to know. So even before I get here, who here feels like they have a healthy gut? A few, not too many, right? So if your gut is not healthy, that is going to be your next step in your healing journey, okay? Because you're going to understand why after I do this presentation, that this is probably one of the things that has been overlooked and is going to be very critical. So who am I? Well, I'm your speaker today. My name is Dr. Monisha Bhanote, and I am a medical doctor, a conventionally trained medical doctor. I trained in 5 specialties. I'm the only one in the country who has 5 medical board certifications. And it is not because I like school. It's actually because the body is so complex that in order to understand how disease develops, it requires continuing training and education. So I have trained in anatomic, clinical, and cytopathology. Who here knows what pathology is? You guys should all have a pathology report if you're in this room, I'm pretty sure, right? So that would be me, the person who made that diagnosis. And I'm going to explain a little bit further what that is. But I've also trained at the Andrew Weil Center for Integrative Medicine and at the Goldring Center for Culinary Medicine. So 2 totally opposite ends of the spectrum. One is the disease and how it is created in the body. And the other end is how do we prevent this? And so my approach when I'm working with patients or I'm speaking is really looking at this more holistic approach of disease can be changed in our body if we understand what to do. So I have a short, limited amount of time to tell you what my 30 years of education has done. So I will do my best to bring one aspect that you might not be familiar with. So here's the key message. Your cells are angry. Who here feels like their cells are angry? Yeah, they're speaking up. So any symptom that you are experiencing, think of it like your cells are communicating. So we have certain signals that communicate in our body, and when they become symptoms, they're talking to us. So it's very important that you listen to the symptoms and signals your body is sending you. So now you can imagine, I put this up because when I was preparing this, LA was on fire. Right? I used to live in California, and I have a lot of friends in California, and I was thinking about them, and I'm like, when you go visit California, it can be beautiful. The weather is great, you know, the sun is always shining, there's parks and mountains and all these beautiful places to go. But now what has happened is chaos has been created because of these fires, right? So now we're having traffic backup. We're having, you know, all this destroyed stuff. So I want you to kind of think of this in your body, right? That when our body is in harmony, everything is working properly. When our cells have the ingredients they need to function, they work properly. When there is some kind of insulting situation, they get angry and they start creating problems in the body. One of the worst problems, obviously, is going to be cancer that it creates. So, let's see. Okay. So I like to think of things in the form of hashtag self-care. Most people know what self-care is, but I really want you to start thinking about the 37.2 trillion cells in your body and how you can use all these different tools to really create health as opposed to disease. So this is what my book is really based off of. Proactively caring for your body with this knowledge that you're gaining. So take the knowledge that you get at the Annie Appleseed conference and put it into practice. Just don't write notes on it. Take it and put it into action, okay? That's going to be the key. So a little bit more background, and I think this is really important to know because I think about like the fear of you go into a doctor's office and you might go in for a colonoscopy for your screening, or you might go in and get a breast imaging, and they're like, well, we need to take a biopsy. And that what happens when a biopsy is taken? What does that actually mean, right? So what happens is whether it's taken in a radiology office, or it's taken in a doctor's office, or it's taken in the hospital, there is a certain sample of tissue that is taken out of the body, and that tissue is then sent to a lab for processing. But here's the thing, whatever's going on in that tissue did not develop in the last 5 minutes. This is a process that has been going on during our lifetime. Okay, so that tissue is sent to the lab and it's put into, do I have a, I don't think this has a pointer. Is there a pointer on here? I got a, oh. Well, that doesn't. Yeah, but there's no screen back there. I have the red pointer here. How do I get it to there? Yeah, but then I can't see what I'm doing too. Okay, so that's all right. So the second image across at the top is their little purple and white cassettes, and the tissue is placed into these different cassettes. And in those cassettes, what happens is it goes through a 12 to 14 hour process of being different chemicals to preserve the tissue, because the point of preservation is so we can look at the cells under the microscope and see the abnormalities or see if they're normal, because these are very subtle changes that happen. So once it happens that it goes through this 12 to 14 hour process overnight, the next day it is put in paraffin. You know, the paraffin that you use for nails and stuff at nail salons? It's put in that. It then goes to the third image, which is a microtome. A microtome is like a super, super sharp blade that cuts that tissue into sections that are thinner than your hair strand. So super, super thin. So now you can imagine it's cutting these into these super thin, thinner than your nail sections, and those go to a stainer. You can see on the bottom right image some purple slides. Our tissue is not purple, okay? Inside our body, we are not purple and pink, okay? We are white, we are yellow, we are brown, maybe a little bit of red, but we are not purple and pink. The purpose of the purple and pink stain, or hematoxylin eosin stain, is really for us to be able to identify morphologic features. Okay, these morphologic features, what they do is allow us to say, all right, this lesion is benign, or this lesion is high grade, the nuclei cytoplasmic ratio is abnormal. There's a lot of mitotic activity. I'm sure some of you guys have heard like how mitotically active the tumor is, which would make your Ki-67 score really high. So these are all the different details we are looking at in the microscope. So these are all the answers that we are getting and giving a report to your oncologist and to your surgeon so they can decide what is the next step. All right, so a pathologist is really a doctor's doctor. We have the answers for the doctors so they can know what to do, which, you know, I find that it's very critical to make sure the diagnosis is correct. Don't feel like it's a bad thing to get a second opinion, especially if you had a diagnosis made at a small hospital, okay? Because some of those smaller hospitals, the clinicians, the pathologists there might have not seen the numbers of cases that maybe they're seeing at a consultative service. Like I know when I was at the University of Rochester, in just 1 year, I had seen close to 100,000 cases. That's a lot of cases of breast cancer, right? Because we were getting consults from all over the country. Now, as opposed to a smaller community hospital where maybe they get 2 cases a week, right? So it's okay to get a second opinion, all right? The more answers we have, the more closer we are to a detailed diagnosis is critical, because most people think that, oh, I have breast cancer, or I have colon cancer, or I have lung cancer, without realizing that for breast, there's 30 different types of breast cancer. So every individual is different. So the treatment, the likelihood of recurrence, all the different things are going to vary, right? And this happens across the board. So pathology is a key part of it. And another thing I've noticed is with my patients is they don't even have their own pathology reports. Make sure you go to medical records and get your pathology report, okay? And I review all pathology reports with my current patients, because when we go through it, they didn't even know that they had lymphovascular invasion, or they had perineural invasion, or yes, the margin was clear, but it was less than 2 millimeters. So these are all details that, you know, if you want to take ownership of what's going on in your health, you want to be an expert in your diagnosis, okay? Don't leave it up to somebody else. And there is ways to learn this. So when I'm talking about different lesions and talking about your cells being happy or your cells being angry, if you look at these images at the top row, these are all happy cells. These are your normal cells. So the top left first one is normal breast tissue. This is what breast tissue should look like. It makes little ducts and lobules. The one right below it with the angry face, that is a high-grade invasive ductal carcinoma. Just one type of breast cancer, right? And it may be a little hard to see in the back, but what happens here is, first of all, those cells increase in size, okay? So instead of being nice, small, organized cells, they increase their nucleus. The nucleus is what actually holds your DNA, all right? So your DNA is now all of a sudden mutated, and it's growing out of control. So the cytoplasm, which is kind of the outline of the cell, decreases in size. What sits in the cytoplasm? Mitochondria. Okay, so mitochondria, if you guys know, create energy for the body. So if your nucleus, and I wish I brought my cell model with me, I usually have it everywhere, but when your nucleus increases in size and there's no space for the mitochondria, this is why we get fatigue. This is why we don't have any energy. And it's not just energy for you, it's energy for the rest of your cells, right? Because that energy that is made by the mitochondria, it needs energy to function. So when you're doing that, you have this increased NC ratio. The second one at the top is normal lung, okay? So normal lung, what it does is it has nice alveolar spaces so you can breathe properly. And we want these spaces so oxygen can flow in and out, and blood can flow, and the body works properly. The one right below it, that is an invasive adenocarcinoma, mucinous subtype of the lung. Okay, so now you've got a lung tumor in there, so you can imagine you're not able to efficiently exchange oxygen. You're not efficiently able to breathe, and you probably won't even notice this until much later that you're having difficulty breathing, because the lung is actually a very large organ, not the largest organ in the body, but it is a very large organ, so it could just be a small lesion there. The next one is colon. So colon is a very uniform organ in the sense that there's certain glands there that help for absorption. Now, the colon is probably one of the most abused organs as well, right? Because every time we are eating a meal, that colon is being influenced by the food we eat. And for you guys who woke up, got a diagnosis, and the next day you went and you're like, oh, I'm going to be vegan and I'm going to be juicing. Yes, that's a good start, but there's a lot of other things there, okay? So, because I know everybody did it. I know everybody woke up and they're like, all right, I'm going to do this. But there's other things that need to be repaired. So The image below the happy colon to the angry colon is a invasive adenocarcinoma, and adenocarcinomas, depending on where they are located, if if they're in the rectosigmoid, because the way the colon is, can actually go deeper deeper than, say, something that is in the ascending or transverse colon, because of the way the body has mesentery. And that one can be much harder to treat because of the location, because of how it has to be removed from the body. And then the last one I'm showing you is thyroid. So at the top, you have normal thyroid tissue. Thyroid tissue likes to make nice glands with the nice pink stuff inside is colloid. And when thyroid is working properly, your thyroid hormones are also working properly, right? But now, say you develop a papillary thyroid carcinoma, which is the most common carcinoma in the thyroid. Your thyroid is not working as properly. You actually get your thyroid taken out, but there might be some other things going on there. And thyroid is a super sensitive endocrine organ. And I often see with my patients who have had breast cancer, later on they develop Hashimoto's, or maybe they develop Hashimoto's first and then they get the breast cancer. So you can imagine, I don't have the picture of Hashimoto's here, but Hashimoto's is basically an infiltration of lymphocytes into your thyroid. So if this is infiltrating, that also means you're not producing your thyroid hormones, which is why these levels fluctuate, which is why you then feel bad. You feel like you don't have any energy. So these are just some examples, and I think it's really important to know what your lesion, what your biopsy looks like for you to get the full answers of what's going on. Like I said, 30 different breast cancers. So a woman who has, say, a tubular carcinoma versus somebody who has an invasive ductal carcinoma micropapillary type is going to be totally different because of the way the tumor acts, okay? So very important. And that's where, if your report says invasive ductal NOS and there is no subtype, let's make sure it has no subtype there, because that could make a difference in recurrence and progression. So now I want to move on to gut health. And now that you get a little idea of where I'm coming from, looking at these lesions under the microscope, literally for decades, and what I have found in my training is because we can control what we eat, we can also control how we heal our body. And that's where I find that gut health is really a key in cancer prevention. And remember when I asked you guys who here feels like they have a healthy gut? I think it was less than 5% of the room. All right. So we definitely have space for improvement here. So why is gut health important? Well, first of all, the gut microbiome. You guys have probably all by now heard about the gut microbiome. The gut microbiome is key because, first of all, your immune system significantly lives in your gut microbiome, right? So about 70% of your immune system is in your gut microbiome. So all you guys going out there trying to get all this treatment for all this stuff, you gotta fix the gut because that's where your immune system is. Have you guys been doing that? Have you been fixing your gut, or have you just been doing green juice? Okay. Have we been doing everything for our gut? Okay. So the other thing is the gut microbiome will influence whether or not you create inflammation. And when I'm talking about inflammation, I'm talking about systemic inflammation. Okay, so inflammation is a key driver to cancer development. All right, and the gut microbiome plays a key role in this. And then the gut microbiome also can play a role in cellular repair. So how your body repairs itself. Did you know that taking one round of antibiotics can take your gut a year to repair? Isn't that crazy? And sometimes we need antibiotics. I will tell you, I just took antibiotics in October. And I did it because I was traveling and just to be protective. And Still doing all the things to protect my gut. So then I did my stool test in January because, of course, I always do testing. And it wiped out so many key bacteria that if I was not testing that, I would not be able to support that. And one of the key bacteria it wiped out, because I have a pre gut microbiome test before I took an antibiotic and a post, was Akkermansia. Have you guys heard of Akkermansia? Akkermansia is key for a lot of health things, but especially for cognitive, for brain health, for neurodegenerative, right? So I'm like, oh no, my Akkermansia is gone. I gotta fix this right away. So this is very important to realize. Then the next thing is dysbiosis. Dysbiosis, all it really means is an imbalance between your good and your bad gut bacteria, okay? So if you have an imbalance, you could have an overgrowth of good bacteria, you can have an overgrowth of bad bacteria, you can have a deficiency in these. And this is why I was talking to somebody yesterday and they were like, oh, I got to take probiotics. And I'm like, but are you sure you need to take probiotics? And do you know which ones you need to take? Because now you could unintentionally create a overgrowth, which doesn't allow the bacteria that are there to actually do what they need to do because they've been taken over by these other ones. So we do not just throw spaghetti at the wall. You want to test, not guess, to make sure you're getting everything you need. And then the next thing is understanding the gut cancer connection can be really critical in helping create new treatments. And that's why I'm going to go a little bit further into that. So my focus is really taking this shift towards something that is actionable, right? We always want to feel like we have some control over it. And this is a place where you guys can actually feel like you have some control instead of just going into the doctor's office and the doctor giving you, all right, here's your next treatment. Let's do scans. Let's do this. This is what you can control, and this is what you can change. Let's see. So the learning objectives for this session, because this was supposed to be a CME section, is really to describe the critical role of the gut microbiome and how it's related to cancer and its prevention. Talk about how gut dysbiosis impacts systemic inflammation, immune dysregulation, and carcinogenesis, or the formation of cancer. Identify those key modifiable factors. And then, of course, evaluate some of the lifestyle factors and clinical interventions you guys can do. Who here thinks they know what these factors are? Does anybody want to take a guess? Anybody know what they are? No? Nobody wants to take a guess. What's that over there? The question is, do you know what the 3 modifiable lab factors are in your gut? Huh? Well, no, that's how you modify it. What is the lab that you need to test? No. It is a stool test, but there's a specific lab, right? So a specific, like, so when you go in and you're like, oh, okay, you have colon cancer and the doctor's monitoring it with CEA, right? There is 3 other lab factors that you guys want to be monitoring regularly, at least once a year. Well, those aren't the names of the labs. Zonulin is not one. All right, I'm going to get to it. All right, that was enough suspense. Let's get to it. All right. So just a little bit on the gut, microbiota gut-brain axis connection. So it's connected through many, many different ways. One of the ways is, like, when we think about the pathways, is the immune system. I already told you that about 70% of the immune system lives in the gut. Okay. The next way it is connected is through the neuroendocrine system, which means that there is biochemical compounds that your gut bacteria produce, some of them being serotonin. Did you know most of your serotonin is made in your gut? Right? Good. Okay, we learned that last year. That serotonin is absolutely critical to helping you feel good, right? So if your mood is off, there is no drug your psychologist is going to give you that is going to make you feel better if you don't fix the gut, which is why they just give you a second drug, right? The next thing is our enteric nervous system. So sometimes this is called our third brain, our enteric nervous system. So what this means is that there is a communication, bidirectional communication, up and down between the brain and the gut. Next is your circulatory. So circulatory is that blood supply, right? So anything that goes through the gut traverses through the wall of the gut into your bloodstream and goes to other parts of your body. So your next meal can influence everything that happens in your body. So keep that in mind when you're driving past a fast food place. Just keep going. Just don't go near it. Because your every meal can change this. So grab some fruit, grab some blueberries, do what you got to do, but try and keep your gut as healthy as possible. And the way this really happens is through a number of substances, whether those are the hormones, whether they are metabolites produced, whether they are peptides or other neuroactive substances. So when we're thinking about gut dysbiosis and cancer development, there's a few things that are happening, right? The imbalance in your gut microbes, so that loss of good versus bad, which I talked about. So this is going to disrupt that symbiotic balance in the gut. How does it do it? It makes inflammation. It produces those carcinogenic metabolites. It impairs immune surveillance, right? So I've already told you the immune system lives in the gut. So now, what is a tumor? A tumor is basically something that has evaded our immune system, right? So are you getting now why the gut is so important? Are we getting it? Yeah. And then, so for example, here's just a few cancers. So colorectal cancer has a specific overgrowth of a fusobacterium. And if you have that overgrowth, your colon cancer is more linked to tumor aggressiveness. I can guarantee that you guys have not been tested for this if you have colon cancer, because this is not something we do in the hospital. Like, I've been in the hospital and tumor boards for decades and decades. We definitely, we check for mismatch proteins. We check for all these different things, PD-L1 markers and all these things that we can then stick a drug on. But what about the things that we're missing, right? And that's your gut microbiome. If you have low levels of certain bacteria which produce butyrate, you're going to have more inflammation in your body. That's one thing I do test. A lot of people have low levels of butyrate, very low. And then breast cancer, gut dysbiosis influences estrogen metabolism, and I'll show you through which enzyme it does that. And we do know that this is very well established that certain bacteria, if you have them, can contribute to cancer development. Specifically, Helicobacter pylori is linked with gastric cancer. And Helicobacter pylori, you might not even know that you have it, and sometimes entire households get it, So you could have it for years without realizing it. So the mechanisms for carcinogenesis, which this is going to be very critical, so I would recommend taking a picture of this. Antibiotics, number one. Yes, antibiotics can be beneficial. Overuse of unnecessary antibiotics is not necessary, okay? So if you have the flu, you have a cold, antibiotics will not work because antibiotics are for bacteria. They are not for viruses. So if you go into your doctor and you picked up a flu, don't walk out with a Z-Pack, okay? Diet will influence it, inflammation, and then just the aging process. And what's happening here is that dysbiosis, which is your imbalance, reduced bacterial diversity. Who here eats 30 different fruits and vegetables a week? Who here eats 20 different vegetables and fruits? Who here eats 10? All right, so we already know where there's room for improvement. And if you're not the best cook, that is okay. That's where soups and smoothies come in. You put everything in, right? And you can get away with a lot, because what happens is you create microbial diversity with the diversity of the different foods you eat. And then these different things can also lose beneficial species. So your bacteria are your best friends if you have the good guys. So you definitely want to keep the good guys. And then you can accumulate pathogens. So keep in mind, every time you walk into a hospital, there is a lot of pathogens there, okay? Anytime you walk into a doctor's office, anytime you go anywhere. So good hygiene is critical. Washing your hands is absolutely critical. So, sometimes when I'm doing this testing, I'm like, where did you pick up this bug? Like, where are you getting these things from? One of the worst places that I see people getting bugs from is from the gym, right? So you go to the gym because you know you got to exercise, but you don't wipe the equipment, right? So this is like, now you've just picked up whatever bacteria that somebody else was sweating, or maybe it's been sitting on there for a long time, and guess what? It goes to the gut. So now they tell me I only have 10 minutes, so we're definitely going to speed up because I've got like definitely a lot more slides. All right. So the immune response cancer. So think of this as a your gut lining, right? So, oops, sorry. So think of this image as your gut lining. Our gut lining is, I do want to explain this to you. So our gut lining is composed of enterocytes, okay? Enterocytes are, when they're healthy, they are nice GI lining cells that stand shoulder to shoulder, right? Like little soldiers, okay? When they are not healthy and they become damaged, whether that's from medications, whether that's from antibiotics, whether that's from pesticides, whether that's from food additives, whether that's from hormones, whether that's from chemotherapy, whatever it's from, these lining cells get damaged. And when they get damaged, they get leaky, meaning that they're not soldiers. It's kind of like on July 4th, right? Everybody goes out and parties. And then the next day they got to go in for work. So imagine our forces, like our army goes out on July 4th and is celebrating. And then the next day they got to be at the war front. They're not standing shoulder to shoulder anymore. They're kind of like leaning against each other. And then this is where the enemies start invading. And same thing happens in our GI tract. When we have that diet soda, when we have something processed, when we are pretty much destroying our gut. And when that happens, what's going on is it's getting leaky, which means that other things can enter the body that we don't want to enter. So why do some people get sick versus other people don't when they eat a meal, right? So like, for example, I just traveled to Asia for a month, and most people are dealing with, they call it Bali belly, right? So they go to Bali and all of a sudden everybody's got all this digestive upset because their forces aren't strong, right? So there's certain things you can do there. Now, when those things happen, they also go to the bloodstream, into the circulation, going to other places, which then make your body create inflammation through compounds like cytokines, inflammatory cytokines. So there's a number of ways this happens. Now, the lab markers, which is really what I'm here for, okay? So there are, what are lab markers? These are measurable biological indicators that can give you some insight into your gut health and your systemic processes. Why are these important? Well, they're important because they can give you a personalized approach to how you can restore your gut microbiome, reduce that inflammation, which is a driver for carcinogenesis, and improve immune function. And then it can help you minimize DNA damage. So the 3 markers that you guys need to be testing at least annually is fecal secretory IgA, short chain fatty acids, and beta glucuronidase. Yes. Fecal secretory IgA, short chain fatty acids, and beta glucuronidase. Okay, and I'm going to go into what each of these is, because these are all modifiable, they are measurable, and you can control them. So about 30% of people have dysregulated IgA levels. IgA is an antibody. It is an antibody that is secreted in the gut as the first line of defense. So what it does is it helps protect your gut mucosal lining, because it can help neutralize these toxins. It can help prevent these harmful pathogens from entering. And it plays a key role in your immune tolerance, right? So creating that homeostasis in the body. Now, when we have very high levels of secretory IgA, it means that you have a defect in that barrier, that enterocyte barrier, right? And it could indicate inflammation, it could indicate infection, and it is seen in many, many diseases. I mean, I have people who have scores of 2, 3, 4, 5, 6,000 of this IgA. Do you guys want to know what my score is? 0. Yeah. I don't make this antibody, right? Because I've done all the things, and I will modify it as I see things going on. Now, when you don't have enough, it can also be linked to problems, right? So weakened gut immune response and different cancers. So some of the therapeutic strategies. We want to treat the root cause of why you would have this IgA. So is it an infection? Do you have a bacteria? Do you have a virus? Do you have a parasite? People are walking around with parasites. Not everybody has parasites like they tell you on social media, okay? Not everybody, but you can test for it, okay? Maybe they have certain food sensitivities, like there's certain things you've been eating for a long time that are creating inflammation in your body. How do you support this? Well, it depends, you know, what's causing it. You can use omega-3s, you can use polyphenols, you can use curcumin, you can use certain probiotics, and you can use prebiotics. And then one of my favorite ways to support mucosal healing is a combination of glutamine, zinc, vitamin A, turmeric, marshmallow, slippery elm, a few of these different things. Yeah, so it's glutamine, zinc, vitamin A, turmeric, marshmallow, slippery elm. What's that? No, I don't use psyllium husk. No. And aloe, yes. And then, so here's a patient example. So this is a 55-year-old with chronic GI symptoms, family history of colon cancer. Did have low levels of this, so we wanted to improve these levels just to make it a little bit better. So what did we do? High fiber diet, stress reduction, probiotics, because they didn't have the microbial balance, and they had improved and normalized levels with reduced inflammation. Now, the next one is the short chain fatty acids. Short chain fatty acids keep inflammation down in your gut and in your body, okay? Where do you get short chain fatty acids from? Short chain fatty acids are your postbiotics. So you have prebiotics, probiotics, which most of you guys know, and then you have postbiotics. Postbiotics are produced by your good gut bacteria, okay? They're metabolite products. So you need the good gut bacteria to produce this. And it's done through eating pre and probiotics. So fiber. Okay, you want to know what diet does not have fiber? Keto. Keto does not have fiber, right? Because if you're eating animal protein, that does not have fiber. If you're eating dairy, there's no fiber in there. And if you're eating sugar, there's no fiber, right? So we need fiber. There's 3 compounds that are short chain fatty acids: acetate, propionate, and butyrate. And what these do is they fuel the colon cells. And they can regulate that immune function to reduce inflammation. They are absolutely critical. When you have low levels of this, you're going to have more inflammation. Your your intestinal barrier is going to be impaired. And it has been linked to many, many different things, including cancer. Now, how do you address this? Well, you want to know why it's low. This is also where that similar anti-inflammatory support comes in. But one of the key things for short-chain fatty acids is more fiber, right? So we're talking legumes, we're talking whole grains, we're talking resistant starches. All of these are really important. And then here's a 60-year-old male with non-small cell carcinoma, and the individual had low butyrate and propionate levels, which are your two of the three subtypes of short-chain fatty acids. And this person also had elevated interleukins and tumor necrosis factor. Oh, sorry. Thank you. Oh, well, you should have told me that a while back. Okay. We are over here. Short chain fatty acids.
Can you go back and let's get pictures of those?
That one?
Someone brought you.
Yeah, I've only got 1 minute, so let me get through to the third one. I think they'll give me a little bit more time. All right. Yeah, so what did we do with this person? So we increased their dietary fiber intake. We also did targeted supplementation, right? So in this individual, we wanted specific bacteria that was going to help produce butyrate. Lifestyle modifications always come in. And at the end, when we did retest this individual's gut microbiome, the short chain fatty acids were improved. We had reduced systemic inflammation, improved immune response, and more importantly for this individual is that they felt like their lung function was better, right? So a better response to treatment. So these factors are used and can be used in cohort with other treatments, okay? It's not like it's one or the other. So then the last factor is beta-glucuronidase. And beta-glucuronidase has been linked to hormonal-related cancers. So what is beta-glucuronidase? Beta-glucuronidase is an enzyme, okay? This enzyme is produced by your gut bacteria, and it helps break down carbohydrates. It also plays a very key role in detoxification, so helping the body process hormones, toxins, and other carcinogens for elimination, okay? But if you have too much beta-glucuronidase in your body, it can allow those toxins not to leave the body. It can allow them to recirculate in the body. So, for example, if we have high levels of this beta-glucuronidase, instead of circulating estrogen leaving the body, that estrogen doesn't break down properly. It actually comes back and goes into the body. And now you've got estrogen dominance, right? So some therapeutic strategies for this is if your beta-glucuronidase is too high, eat more fiber, right? Prebiotics, beans, whole grains, cruciferous vegetables. You can take certain probiotics. This is a time where, depending on what your score is for beta-glucuronidase, you might want to try calcium D-glucuronate. Note that this is a compound that is found in apples, citrus, and broccoli, but there's literally only so much broccoli an individual can eat in a day, right? So you might actually need supplementation. You want to cut back on high-fat, low-fiber diets because this will disrupt your gut microbiome. You want to improve your intestinal permeability, and you want to check for food sensitivities. If it's too low, you want to increase your diversity of your foods that you're eating. Remember when I asked you if you're eating 30, 20, 10, how many are you eating? There's no minimum. The more you can eat, the better, right? And then we also want to make sure we're getting phytonutrients because phytonutrients are needed to help that beta-glucuronidase. So so even though this says IgA, we couldn't change it, but this is a beta-glucuronidase patient. So a 48-year-old female with history of estrogen-positive breast cancer, and she had high beta-glucuronidase levels. She also had gut dysbiosis, signs of estrogen dominance. What did we do with her? High fiber diet. We did give her calcium D-glucuronidase supplementation. Probiotics. We also supported her liver, right? Because the liver is a key in phase 1 and phase 2 detoxification. And we were able to lower her beta-glucuronidase levels, improve her estrogen metabolism, and lower her risk of recurrence. So once again, let's see. Key markers: fecal secretory IgA, short-chain fatty acids, and beta-glucuronidase are measurable and can give you key insights to how your gut is playing a role in cancer. So what we want to do is take these insights about the gut microbiome testing and develop personalized interventions. So I've already mentioned that every aspect of your health is influenced by your gut, so much so that it's not just cancer, all right? Take a picture of this, because if you're dealing with any of these issues, and I wish I had a bigger slide for this, whether you're dealing with autoimmune issues, heart disease, mental health, skin issues, this is all related to your gut microbiome. So at the end of the day, self-care is self-care, and what we're going to start doing today is all of us are going to start taking care of ourselves. I do have a free gift for you, which is the first chapter of my book. I do have limited copies of my book here. I'll be out by the table later this morning. But you can take download the first chapter and start reading there. And connect with me on social media. I'm Dr. Bhanote, the only one and only. And yeah. And I'm around for questions this morning, so feel free. I know this was a lot, and I kind of had to rush through it. Next time, they should probably give me 2 hours. So, Julia?
I know, and I apologize. And you are the only Dr. Bhanote, because I said Dr. Bhanote there earlier, so that's another doctor. But thank you. And there's 27 feet from your mouth to your anus. And there's a lot that goes on, and so when your gut's off, everything is off, and so I am in total agreement with that. There's a documentary that Corinne and I saw on a plane ride from here to UK one time on United, and I can't find it, but it's called The Second Brain, and if you can find it, it's an incredible. Is it Amazon? Yeah, it's a great documentary, and this is. But thank you, and then again, your antibiotics versus your probiotics. It's amazing what one round of probiotics or antibiotics can do to our gut. So we are not antibiotics. Yeah. Okay, they can be necessary and important, especially when going through surgical procedures. However, you do want to protect your gut when you are taking it. So. Yeah.
So,
So we have a few questions.
First one here. Yeah. Okay.
Time for two or three
Thank
questions.
you. In light of cancer patients and knowing that every case is nuanced, can you give us a generalized idea of how often you would test for those 3 markers, and if there's any particular situation you would do more than that, like after a procedure or something like that?
Yeah, absolutely. Thank you. That's a great question. So her question was, how often do you test these 3 markers? And is there any specific timing to testing them? So I recommend at minimum to test it once a year. Okay, I do my testing once a year. Now, if you are undergoing treatment like chemotherapy, which is a key player in disrupting this, after your treatment of chemotherapy, you're going to want to do it, and you're probably going to want to do it 6 months later after you've gone through some of the treatment to see if it's working or some of the stuff needs to be modified. Because after chemotherapy, enterocytes, GI lining cells, they are healing very quickly and replicating very quickly, right? So we want to make sure we're on the right path there.
Thank you, Dr. Bhanote. Second question.
Where do you go for the stool testing?
Yeah, so there's a number of labs you can do for the stool testing. There's 3, 4, I think 5 different ones on the market. The most important is not just the stool testing, it's the interpretation, right? So there is GI map, there's a GI stool, there's a number of them. Yep.
Should we go for final question?
Yeah.
Yeah?
Could.
Okay.
And I have a couple of people that are going to want to talk to you afterwards, so if you
Yes.
could make yourself available out in
I
the
will be
hallway.
at the table where they put me for my books. That's where
Right. So in the book and advocate hallway where Healing Strong and Dr. Jen is and Dr. Salpa, Monisha has a table there as well. So just meet her there if you have any other questions.
Okay,
Yeah,
one more question.
Doctor, I was wondering if you can say briefly on mycotoxins and effect on the microbiome in the brain.
So mycotoxins in general, it is a sometimes over thought out thing. You want to make sure you have mycotoxins, okay? Not everybody has them, but if you have had exposure to them, it doesn't just impact your brain because remember the gut and the brain are very closely intertwined. So the treatment for mycotoxins is also through your gut, not just addressing the brain. Okay. All right, thank you everyone. I will be outside.